Hello there, this is John again, and this as an introduction to San Diego County's trauma catchment system. Remember that if you are determining whether or not your patient meets trauma criteria, please use algorithm T460A protocol, and that is in your protocol book. So here's a map of the county catchment areas. There's 5 of them. They correspond to the 5 trauma centers, as you can see here. And the purpose behind this is that if a person is injured with any particular catchment and they're 15 years of age or older, they should go to that catchment's trauma hospital. So if you're in Escondido or Fallbrook or Borrego Springs, that patient should be flown or driven to Palomar Hospital. If you're on Camp Pendleton, if you're in Oceanside, Carlsbad, Del Mar, La Jolla, they should be flown or driven to Scripps La Jolla. And same with Sharp, same with Scripps, and same with UCSD. So you can kind of see there's a pattern there. The one exception to this are pediatric trauma patients that meet the T460A criteria. So those patients are going to be flown or driven by ambulance down to Children's Hospital. So they'll bypass all those other adult trauma centers and go all the way down to Children's Hospital for that. Now, with any system, there's always complexities and glitches. And one of the glitches I've experienced personally a few times is when these trauma catchments kind of come together. And if you notice on the screen, there's those 3 small maps. The middle map shows an area around Mission Bay, and it's right where the 5 and the 8 kind of meet right there. And you'll notice that 3 catchment areas meet right there. And I've been on calls, I've been on train accidents and things like that in that area where you could literally walk a block one way and you're another catchment, and you walk a block the other way, you're in another catchment. So all I can say is if you're just absolutely not certain which hospital catchment that you're in, the best thing to really do would just be to go to the closest, most available trauma center. So based on traffic patterns, time of day, weather, and all that, just go to the closest trauma center to you. You could always rationalize that if someone asks you or questions why you didn't go to a particular trauma center, or say, it's the closest hospital and I had a really sick patient, and then that's enough probably for them. So a couple more things. So if you are taking a pediatric patient to Children's Hospital, either by helicopter or by ground ambulance, the county wants us to contact Sharp Memorial Base Hospital Radio, and that way you'll give your report to Sharp, and the Sharp will call Children's and relay your information. They do not want you to call Children's direct by EMT radio. Other thing here too is that all these 5 hospitals that on the screen here, these trauma centers are also stroke and STEMI centers as well. So if you have a patient who's crashed their car because they had a stroke and they have serious traumatic injuries, plus they're having a stroke, or someone's fallen off a scaffolding 20 feet to the ground, they got serious spinal injuries, but they've also had a heart attack and that's why they fell, you can see where these are full service kinds of hospitals. So they can handle the stroke, the STEMI, and the trauma. The one thing you do have to be sure of, though, is your destination. So if you're out in Escondido somewhere, you're out in Fallbrook somewhere, and you've had someone who's crashed their car due to a stroke, you're going to call Palomar Hospital directly, and you're going to say, I've got this person, this is what I have. I think they're also having a stroke. Is your stroke center open? A lot of times these hospitals, the stroke center, the STEMI center, and sometimes even the trauma portion of the hospital can be out of service. It's called being on bypass. So let them know what you have, so they can say, yes, come on, and we're here for you. Or they say, no, we can't handle this patient right now. Go to another hospital. Lastly, in all this, if you look at the bottom of the map, what you see is you have UCSD Hillcrest in the green and Scripps Mercy in the brownish color, whatever that is. They hug the border right there, and if we have people coming across the border from Mexico, either Otay Mesa crossing or whether it's San Ysidro crossing, I worked down there at the border for about 2 years. It was a fun place to work if you want a lot of sick patients and a lot of fun. But we get a lot of trauma patients across the border, gunshots and car accidents and people getting beat up and stabbed and all kinds of fun calls. So if you have a trauma patient that meets trauma center criteria coming across from Mexico, they're either going to be driven across the border by a Mexican ambulance, or they could be driven by private vehicle across the border. It's usually kind of rare, but it does happen. Or they walk across. I've had people with gunshot wounds and stabbings that have literally walked through customs to get to the American side, and then they call 911. These patients, if they're coming from Mexico, the county wants us to divvy them up between UCSD and Mercy to kind of reduce the workload on both hospitals. So you can see the criteria on the left side of the screen. So border trauma patients, odd months, they're going to go to Mercy. Even months, they're going to go to UCSD Hillcrest. Just really simple criteria. Sometimes you get patients that are not really sick trauma patients. So they're mild status trauma patients. They're mild status medical patients. And maybe they just want to go to the closest available emergency room. And that would either be Sharp Chula Vista or Scripps Chula Vista. Both are fairly close to the border. If they're coming from Mexico, there's another criteria for that. So if they're coming across the border and they want to go to the closest hospital, on odd days, you take them to Scripps Chula Vista. On even days, you take them to Sharp's Chula Vista. Again, just to help to break up that workload of these two hospitals. If the patient has a requested hospital, they come across the border and say, I want to go to Kaiser, we'll take them to Kaiser or wherever else they want to go, within reason anyway. Anyway, that's all I want to talk about. I think we're done here. We'll see you in class.